Hi, everyone, and welcome. My name is Richard. I'm a psychologist here in Ontario, and today I am really looking forward to speaking with one of our clinical associates, Vaishnavi Nadesu. Vaishnavi and I have been working together for several years now. She is a registered psychotherapist here in Ontario. I'm really looking forward today is to speak with Vaishnavi about the topic of postpartum depression. Vaishnavi, thank you for joining me and participating in this really important topic. Um,
hmm the only thing I would mention, I think, is like in terms of postpartum, the reason that it's so like near and dear for me is because of my own experience with it too, as well. I think every mom obviously goes through their own challenges, but like ones that have been through postpartum depression, definitely, and anxiety also has their own unique experience that they can bring to it, like especially from a therapist standpoint. So that's why this is so important for me.
Thank you for sharing that. Yeah, so many times, right? The things I think some of our clients or people in the public just don't often think about is that a lot of the issues we often deal with and with our clients in our practice are things we've often dealt with in our own lives, which helps us, I guess, to build empathy, with our clients, and also gives us a little more of this personal knowledge that comes from, personal experience. So I
Mhm,
appreciate you sharing that. I'm looking forward to hearing about some of your experiences. So
mhm.
first off, Vaishnavi, tell me what is postpartum depression? How would you describe it?
So with postpartum depression, it typically tends to be looking like that it's after 2 weeks. So typically mother delivers baby, they experience sometimes like baby blues.
Mm,
Usually those symptoms subside. However, if it lasts longer than 2 weeks, then it tends to be classified more towards postpartum depression. This could look like anxiety, difficulty bonding with the baby, difficulty with sleep. So, like, it might be you're sleeping too much, you're sleeping too less. Same thing with appetite, eating too much, eating too less,
mm,
um, crying often, socially isolating yourself, a lot of feelings of guilt, shame, worthlessness, sometimes suicidal ideation as well, and essentially feeling fearful that like they're not a good mom. And so those are typically postpartum depression. But there's another form of postpartum depression, which is postpartum psychosis. And that typically you would see it occur within like the first week right after delivery. And that is accompanied with like usually a lot of those symptoms of like depression, same things I listed, but it's also accompanied by like hallucinations too, as well. And thoughts of harming themselves or their baby too, as well.
so much more severe. The psychosis is
Much
much
more
more
severe.
severe than the
Yeah.
depression. Yeah, and you were talking about when you were talking about postpartum depression and some of the symptoms, which were very uh, common, shared across a diagnosis of major depressive disorder, where it
Mhm,
affects appetite, affects sleep,
mhm,
affects your interest in hobbies.
mhm,
Um, but one of the things I was thinking about is along the lines of like just the stigma
mhm,
sometimes. And I think there's a stigma because we have this belief in society. I think a lot of people that, oh, when you have a child, it should be such a joyous,
mhm,
beautiful, wonderful experience. You should feel like you're on cloud nine.
mhm,
And but that's not always the case. And I
mhm,
think for a lot of mothers who perhaps go into childbirth thinking that this is how they should feel, and then
mhm,
realizing sometimes just before childbirth or afterwards to
mhm,
realize like, oh my gosh, this I'm exhausted. This
mhm,
isn't as joyous as I thought it was going to be. And I think
mhm,
that sometimes adds to feelings of guilt, feelings of shame, feelings
mhm,
like of inadequacy. So there
mhm,
really is this, I think that just compounds like that feeling of stigma, and just
mhm,
makes it even more difficult for
mhm.
a first time mom, especially.
Of course, like when we have expectations that this is what it's going to look like, and it doesn't tend to be that way, then again then feel like we are doing something wrong, right? So that's where those feelings of like inadequacy of like being a mom, like is this what it's supposed to look like? Feelings of guilt, worthlessness, hopelessness, even too as well, right?
Yeah.
The lack of support, if that's there, that impacts it a lot more as well.
One thing I was reading about too is that, sometimes there are these risk factors that
Mhm,
can make someone, I guess, a little more susceptible to postpartum
mhm,
depression.
mhm,
Can you mention some of them, or what have
mhm,
you come across in your practice as some of these
mhm.
risk factors?
So sometimes it tends to be, like I mentioned, so lack of support. Um, the person has had multiple births, so like twins, triplets. It kind of makes them feel more overly tired, obviously.
Mm,
A difficulty with breastfeeding too, as well, is another factor. If there's any sort of family history of like depression, for postpartum psychosis, if it's like bipolar or schizophrenia, those they are more predisposed to get postpartum depression. Things like financial difficulties too, as
mm,
well. Life stressful events, so like job loss or pregnancy related issues, as well, because a lot of people forget like postpartum depression is, it's not only that you can have that after giving birth, but it's also during pregnancy as well. But another like risk factor for postpartum depression, because like sometimes women can have the baby after delivery, but not experience postpartum depression. And then later on, once they stop breastfeeding, actually be diagnosed with postpartum depression
mm,
because there's a decrease in the oxytocin and the prolactin levels that make them actually change their mood significantly.
yeah.
So that's one of the other things too, as well.
Sometimes when I'm talking with a client around things like, it's a chronic pain,
Mhm,
or even anxiety, those two issues mostly. I talk about oftentimes like the relationship between our mood and the
mhm,
physiological sensations. So,
mhm,
for example, the rapid heart rate, the sweating, maybe you have pain in your back, tension
mhm,
around the heart, all these physiological sensations, how they affect the way we feel emotionally. But in
mhm,
the case of childbirth and pregnancies,
mhm,
when a woman is, carrying around the child, there
mhm,
are just so many hormones being
mhm,
produced
mhm,
by the brain. At
mhm,
no other point in their life are these
mhm,
particular hormones produced that quantity. And
mhm.
you figure like that's gotta affect someone's mood. That has
Ab
to affect it, right? And I
Yep.
think it's such a perfect example of this
Mhm,
postpartum depression, of how, yeah, our just own biology,
mhm,
just the chemistry of the brain
mhm,
affects our emotional health.
mhm. Another one for that imbalance is also thyroid levels. Like typically, most doctors also, while they're pregnant, they also check for thyroid levels because of that reason, because it also impacts your mood
Mm.
as well. So like when the woman is pregnant, usually there's an increase in that thyroid level and then a decrease after delivery. So mood swings are much more likely to occur as well.
So someone comes into your
Mhm.
office, or they're working with you virtually. What are some of the things you start to look for?
I think typically like I go based off like what the client is telling me to really, and also asking the question that, what's your relationship like with your baby as
Mm,
well, right? What was your pregnancy like too as well? Because sometimes some people discount that as well. Support system, if there is even a support system, because that makes a huge difference again, like pre when they are pregnant and then afterwards too as well, because that support system, like we all know, is it takes a village to raise a child. Like
yeah.
it's rarely ever like two parents anymore, right? We need more help because majority of us typically are working and also trying to take care of children. So a lot of burden is placed there as well.
Mm. It's a great point. You're making me think too about our own experiences. Our my in-laws were just fantastic during the birth of our kids. Just those
Mm,
first few months, just giving us so much support because,
mhm,
yeah, you'd hear people talk about, oh, say goodbye to sleep,
mhm,
and I say, yeah, I'm okay. I don't need a whole lot of sleep. But boy, oh
mhm.
boy, what's that?
You do.
What you do. And,
Yeah.
again, it's just another example of how something like sleep, right? The sort
Hmm.
of mind body connection, right?
Hmm.
How our bodies affect our mental health. When your
Hmm.
body is deprived of rest and relaxation or sleep, it doesn't
Hmm.
rejuvenate, and that affects your mental health. And
Hmm.
having people, in our lives who say, hey, I'll watch the kids while you guys take a nap, was just so beneficial for us.
Mhm.
Yeah.
Mhm.
And then there's that piece around the pressure
Mhm.
of returning to work, and that raises this whole other
Mhm.
conversation around, yeah, the just sort of government policies and
Mhm.
employer policies, and
Mhm.
how some moms in some countries just don't have that maternity leave. It
Mhm.
might be 90 days at most in some
Mhm.
cases, but that all
Mhm.
affects, all those things affect
Postpartum
the
depression, yeah.
postpartum depression. So you look at that relationship between mom and child. What are some of
Mhm.
the things you're listening for?
Also, if they're feeling overwhelmed, if they're feeling like they're not taking care of themselves in any way, or feeling
Okay.
pressures of like feeling guilt for even wanting to take care of themselves, feeling if they have a lack of support from their partner too as well. Like that relationship is probably the most important one because they always typically need like two parents, and if there's an absence of that, sometimes they're single moms too as well, or single dads.
Mm.
There's tremendous amount of pressures just for them to be able to do it themselves, constantly feeling like they're failing too as well. Never meeting up to those expectations and standards as what they had thought, like you had said before, what they thought this was going to look like.
Yeah, I remember before um, we had our kids. I remember when Sabrina was pregnant, I'd come across an article. I just sort of was googling some stuff, and it looked at the a person's beliefs about how they think they will function, how they will be as a parent,
Mm-hmm.
and people are saying, oh, I'm going to be great. Like they tend to have like very high elevated scores in
Mm-hmm.
terms of rating their own abilities,
Mm-hmm.
rating their own emotions, what it would be like for them, how they would feel about it. And then after the child is born, you ask them those same questions, and it's such a drastic change, a huge
Mm-hmm.
drop, right? That how we think our ideal, how we
Mm-hmm.
think we are ideally going to nurture and raise our child and interact with our child versus how we
Mm-hmm.
really do is
Mm-hmm.
such a disparity. Uh,
Mm-hmm.
and
And
and I
especially even like you said, like the expectations. So like not only for the first child, but even the second child, thinking that, with the first child, like we went through these challenges, we figured it out. And then when the second child comes, it's different because that attention now is so divided, right? It has to be divided. So I have a lot of clients that typically end up just, one parent does one child, the other parent does the other child. It's just easier that way for them, they find. So the subsequent children, like if you're having three, four, just like it impacts the marriage quite a lot, obviously, impacts the attention that you are giving that child to as well. It's not impossible, but it's just that's why that village is so important as well.
yeah, just a few things now you've mentioned just made me think, around the value of having this other parent, the other partner,
Mhm.
you know. Um, so it makes me think, like, what are some of the things that you've heard that can be most helpful, or some of the experiences you've had that can be most helpful for this other parent to be supportive of of the parent who gave birth?
Mhm. Typically, it's, looking for signs if they are actually taking care of themselves, like finding times for self-care, allocating that time. If they're really struggling, also seeing if, like, okay, do you need to go for counseling? Do you need to have a conversation with your
Mm,
doctor, maybe about medication? Because some clients are also very hesitant to take medication because that might impact breastfeeding, or, they have negative views surrounding that as well, but there are medications that are safe as well for breastfeeding. The other pieces too, as well, being, when it's sometimes when we think about postpartum depression, we typically think it's mostly the mothers, but it's also the dads or the other partner that can also be impacted because when the mother is typically depressed, that risk for the partner to be depressed is also high as well, because again, huge strain on the relationship.
right. So it really, speaks about the impact that this event of childbirth has on the entire family system. Right, just making me think of family systems therapy now, and just how, yeah, the child has an impact on the family dynamic. And in this particular event, you're absolutely right, how just their birth,
Mhm,
um, something joyous and something that
mhm,
I'm sure the parents were looking forward to, but
mhm,
how quickly life has changed.
mhm,
And I could see how that in itself would create some guilt in both parents,
mhm,
where it's like we're tired, we're
mhm,
irritable, we're not doing
mhm.
the things we used to do. I'm getting out of shape, I'm not eating well. I
Intimacy
thought
is
this,
another big one.
sorry?
Intimacy is another big one too as
Another,
well.
yes, yes, yeah, sex life goes out the door,
Mhm,
and then and then here we are thinking, oh, but I thought this was going to be a joyous, wonderful thing.
mhm,
But
mhm,
and it is a joyous,
mhm,
wonderful thing, but we
mhm,
do need to, it's a major, major transition,
mhm, mhm.
major life
I think
event.
another big part too as well, like another way a partner could help too, part of self-care, but also making sure that the individual doesn't isolate themselves, right? Because we know typically
Right.
with a lot of mental health conditions, usually when there's a lack of support system and they're isolating themselves, usually impacts it negatively, right? Their mental health.
That's great. Yeah, 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 you're absolutely right. That just goes to speak to, yeah, just the power that, just the influence, the positive influence that
Mhm,
another parent and their partner can have.
mhm,
um one of the things and I'm starting to think now just about some of the things I've done that maybe I would sort of, do differently, is, when I've worked with some mothers who have come in and told me about some of these sort of very harmful thoughts they've had. And I
mhm,
attribute it to postpartum depression, and I um, often normalized it. I
mhm,
said, look, this is typical, because I guess
mhm,
my focus as a clinician as the time was that I didn't want these mothers to feel additional guilt
mhm,
for
mhm,
having these thoughts.
mhm,
But I think, you know, as I've been reflecting on this interview and reflecting on the topic, I
mhm,
think the thing about, it's one thing to say, hey, this is understandable why you might be having these thoughts, but
mhm,
then it's another thing to minimize it,
mhm, mhm,
and I often wonder if perhaps I've minimized it at times.
mhm,
This is back in the day when I was younger and in
mhm,
grad school, and dealing with these issues and having little knowledge about it.
mhm,
But just sort of, just recognizing, like, it's one thing
mhm,
to have this condition,
mhm,
but it's another thing to sort of sweep it on the rug, under the
mhm,
rug, and say, "Ah, you're fine," because I think in
mhm.
that way we're sort of like minimizing, like, the impact and not giving
And their
voice.
experience, what they're
Yeah.
going through, exactly.
Yeah.
Yeah.
So one of the things I wanted to also ask you about is, you talked about this difference between, like, postpartum depression, but also there's postpartum psychosis,
Mm,
which is, I guess, a very different, more severe form
mhm,
of PPD. Could you talk a
mhm,
bit about that?
mhm. So typically with postpartum psychosis, you would see individuals, like I mentioned, like having hallucinations or delusions, more at risk to harm themselves or their baby. They try really hard to get help, but also have an intense amount of guilt. So this sometimes requires hospitalization.
Mm.
And so again, like as much as that they want the help, it's also the feeling that, oh, I have to be away from my baby. So sometimes they don't even get the help as well. But it's good, obviously, if they are, again, connected with their doctor, because like we've seen these reports come on the news so often too, as well, right? Where mothers struggling with postpartum psychosis like this, it ends up being fatal for the baby or the mom or both, right? So if the partner can see that the mom is struggling and having and experiencing some of these thoughts, that they're having thoughts about harming themselves or their baby, really encouraging them to go see the doctor too as well, having a conversation with their therapist that can also flag this.
Okay, so when it gets to the point where they are sort of thinking of harming themselves or their child, so then that is sort of a red flag, and where
Mhm.
they got to seek some more medical help, perhaps.
Mhm.
Okay.
Mhm.
Okay. Um, what are some of the things that you would recommend, or some of the interventions you would use, some of the things you would suggest to a client who's coming in with postpartum depression? Because they've only got, let's say, an hour to work with you.
Mhm.
So what is it that you would recommend for
Mhm.
moms
So
going through
typically
this?
when I work with a lot of moms or even dads struggling with like postpartum depression tends to be more on like a CBT level, so cognitive behavioral therapy, mindfulness approach, and everyone's experience is different. So depending on how severe their symptoms are. So it's typically like CBT, mindfulness, but also exposure therapy, especially if some moms are mainly more struggling with like postpartum anxiety. And so again, challenging themselves through that, especially if they've had comorbid conditions, so like OCD, GAD, you're definitely going to see a lot of postpartum anxiety as well come up for them. So the exposure therapy helps them quite a bit for that. Another thing to also encourage them as well for therapists is that if we feel like things aren't necessarily improving after like X amount of time, then maybe considering as an option antidepressants too as well,
Mm.
because some clients, like I mentioned, very resistant to that. And the main thing for us to focus on in therapy is like encouraging self-care and constantly reminding them of that, because it's so easy when you become a mom or a dad for you to forget yourselves. Like it's more about the baby than it is about yourselves. But the best way that that baby is able to develop and flourish is if the mom and dad are doing better too as well.
That's a great point, and I'm glad you mentioned that. Just the value of self care and the importance of like taking
Mhm.
care of ourselves. That it's not about being
Mhm.
selfish; it's more about having self love, self respect,
Mhm.
self worth, and that
Mhm.
once we do those activities that fill our cup up, so to
Mhm.
speak, then we
Mhm.
actually become better parents.
We're
Yeah.
able to regulate our own emotions better when we do those things versus if you're constantly tired, constantly irritable, you're going to react much more quicker. And so we see that's why a lot of parents, like some of my clients that have come in to see me, struggle with that anger management that they say, but it's actually like the difficulties with postpartum that they
Hmm.
faced. And so we work through some of that, and usually with the implementation of like self-care, those kinds of things really make a huge difference for them.
Hmm. Gosh, this has been excellent.
Mhm.
I've really enjoyed this. I've learned a lot from you. Um, and I'm really happy you mentioned about that self care piece and the
Mhm.
importance of taking care of oneself, of living a more balanced life. For all of you people out there, thank you for watching. Uh, if you would like more information, check out our websites, www.psychologyforgrowth.com. And if you click on our associates, you will see Vaishnavi's profile there, and just feel free to click the button and to arrange an appointment with Vaishnavi. Everyone, and if you like some of the information here, then feel free to check out my book, psychologyforgrowth.com, um, the promise wheel on psychologyforgrowth.com. And there's a lot of the strategies that we talked about here with regards to improving your mental and emotional health. Thank you, Vaishnavi, and hope everyone has a great day, and look forward to speaking with all of you soon. Take care.
Thank you.
All right.